What if the secret to living longer and feeling better isn't just in fixing what's broken, but in preventing problems before they start? I'm joined today by Dr. Michael Day, a board certified orthopedic surgeon turned longevity physician, who's now leading the way in proactive, whole person healthcare. In this episode, Dr. Day shares why he made the leap from surgery to prevention, how working with the franchise model can boost patient care, and the real impact of integrating different wellness approaches. We'll also talk about his book, The Renaissance Mind, and get practical strategies for joint preservation and managing osteoarthritis. If you're curious about the future of health, or you just want some tips to keep your body moving for years to come, you'll want to stick around for this one. Today, we are sitting with Dr. Michael Day, longevity physician of Structure Elements. Welcome.
Thanks for having me.
Absolutely. Absolutely. So you've transitioned from orthopedic surgery to a more preventative approach in the longevity space. Could you share what motivated this career pivot and how it changed your approach to patient care?
My background and training is in orthopedic surgery and sports medicine. And I was practicing orthopedic surgery. I was serving as a team physician for a number of local teams. And I found that our traditional healthcare system and my orthopedics practice was no exception, was that was really treating injury and disease and coming to that intervention late in the game, especially in terms of chronic diseases. In orthopedics, most common would be osteoarthritis, where a joint wears out, and we can really increase quality of life by replacing that joint. But I really thought that there's a lot of things that we can do before it gets to that point, and I wasn't meeting those patients until they were further along on that disease pathway. And then for my own self, my own pursuit of health, inspired a lot by the three kids that I have and wanting to be as healthy as I could for as long as I could to be there for them. And then all the things that I sought to do for my own journey were things that I thought were applicable that I could share with patients. So the combination of kind of a dissatisfaction with the preventative aspect of the traditional healthcare system, both for myself and for my patients, led me to the more preventative practice that I have now.
Okay, okay. So your practice operates within the structural elements franchise model as a micro franchisee. How has this business structure benefited you compared to maybe starting a traditional private practice? And then what advice maybe would you give other practitioners considering similar models?
Well, the structural elements started as an orthopedic wellness clinic back in 2013. Comes from a strong tradition of manual therapy, acupuncture, and a specific way of viewing body mechanics, and really seeks to get people to back to what they're doing from a physical standpoint and moving well. And with my background in sports medicine, it was really aligned in terms of the holistic approach, looking at whole body, talking about big picture posture, and not just the focusing on a single joint. And in sports medicine, in joint preservation, we look at not just the pathology of the joint, but what's the stability of the joint, what are the muscles that can protect the joint, and if someone's undergoing a surgery, what sort of health of the person is going to sustain their ability to heal through an intervention as great as a surgery. So the one, it was aligned with a holistic treatment philosophy. Two, it gives the advantage of not having to reinvent the wheel in terms of a lot of the logistics of opening a business. So when you ascribe to a franchise system, you first want to make sure that you are aligned with that brand and that philosophy, because you're not going to be able to set that as an individual. You're joining part of an existing system. So the trade-off in some of that individuality that you gain is not having to worry about building out a space, taking on debt to open a practice individually, the hiring of front office staff, back office staff, preparation of financials and branding and advertising. This is all was all in place when I decided to become a micro franchisee. And so in my situation, I um, didn't really want to take on the leverage of a large debt. In fact, I didn't take any debt. I was able to open a practice with, I started an LLC to have my individual business entity and got malpractice insurance, got my own accounts financially set up, and I was able to jump in and start seeing patients day one without a lot of overhead, which was attractive for me. So advice I would give to people, facing a similar choice is, one, to assess what degree of control they want over employees and branding. And I don't have any employees, so that's fine with me. My business entity is one person. I have a lot of colleagues that I work with. Some are other micro franchisees, some are employees of the clinic itself, some are 1099 contractors, but I'm not personally responsible for them. So that suits me in the business model that I desired. But other people, you may want that degree of control. You may want 100% control over hiring and firing. So one is to decide the degree of autonomy that you want or directorship that you want in the practice setting. And then two would be to just, if you're going to join a franchise system or some group dynamic that's not 100% individual, just make sure that the philosophy is aligned and that because you're choosing a mission more than just choosing a franchise brand to be part of.
Good, good. And I'm sure you did a lot of research and checking into what you wanted, what you didn't want. That sounds like it was a good fit. Okay, so your practice philosophy focuses on being proactive rather than reactive in healthcare. Could you elaborate on how this approach differs from conventional medical practices?
So our traditional medical system is fantastic in many ways, and I think those ways are primarily treatment of acute injury and illness and complex care. So if you are having a heart attack, if you are hit by a bus, if you have an advanced cancer, um, if you're born prematurely and you need neonatal ICU. We have a fantastic system for addressing those very acute or complex medical needs. Um, where our system doesn't do as well is the prevention of chronic disease. And there's a whole host of factors that have gone into making the system the way it is. It's very complex and convoluted history, but the end result is that our system hinges on diagnosis and treatment. And so if you don't have a diagnosis, you don't really have an economic role in our medical system. And I think that's where this proactive approach can provide an additional layer of promoting health over and above what the traditional system can do. And it really pays dividends to invest early in health, just as it does financially investing. Because if you can delay the onset of chronic disease, you're going to extend your life more and your quality of life more than if you wait until you have a diagnosis and then treat it. So that is kind of the philosophy, and the way that gets implemented is we do testing to even before a diagnosis, and we try to do it thoughtfully such that we can see this system is starting to trend towards not being able to function properly. Diabetes as an example, where that takes decades to develop. If we pay attention to the way that we metabolize carbohydrates and blood sugar, we can sometimes say, hey, here are early warning signs that you're headed down this path. And so that at that point, lifestyle changes may be able to delay or prevent that diagnosis. Whereas if you just went along with your life without giving too much thought about it, you might one day at your annual physical be presented with a diagnosis of diabetes or prediabetes. And at that point, lifestyle interventions may not be enough. You may be facing pharmacologic interventions or more aggressive treatment, and you may have already done some damage. So my philosophy is that if you can pay more attention proactively, then you can make smaller interventions that can have a bigger payoff in the long run.
Your practice combines traditional medical services with various wellness modalities like massage, chiropractic care, and recovery treatments. How do you ensure these different approaches work together cohesively for patient care?
We have everyone in the clinic here has the same mission, which is to get the outcome for the patient. And so it's really everyone is focused on that. And so there's not a lot of ego in being the one that is the hero of the story for that patient. Everyone is trained in the philosophy of the structural elements, kind of holistic approach to body mechanics and health. Even if they're not specifically having the expertise of doing manual therapy on the body, for example, whereas I don't personally do acupuncture or any manual therapy. We have yoga and Pilates instructors that are not doing any particular acupuncture, but everyone um, buys into this philosophy that there's a holistic approach to the body and that the overall biomechanical health of the body is key to injury treatment and prevention. And we share common documentation and an open door policy where we're always available to offer our expertise to someone that's struggling with a problem that they haven't been able to solve or just wants a second opinion or advice. So we really encourage people to seek out each other's advice and even be treated by each other, so, experiencing the treatment that patients get. So I, for example, regularly will get a deep tissue massage, the acupuncture treatment. I work with one of the Pilates instructors on reformer Pilates. And so you get to experience what the patient is experiencing, and that enables you to put that in perspective and tell them how they might benefit since you've personally experienced it.
I love that. I don't hear that often. That you're trying out the different services and stuff. And so you can be that patient and even to give feedback or what that experience was like on the other side, right? You can share, it's teamwork. You're helping each other out. Thanks. Okay. So you published a book last year as part of your personal branding efforts. How has this contributed to your practice growth? And what advice would you give other wellness practitioners looking to establish maybe their own authority?
Yeah, this has the book is it's called The Renaissance Mind, and it's kind of part memoir, part personal development book. So I tried to weave in a story that would be interesting, compelling enough to read, and also have some practical applications for people that are just looking to kind of optimize their not just their health but their overall life. And so I kind of go through my philosophy of how I approach life and training and family. So it has been, there's a credibility piece to writing a book, and you hand someone a book, they're unless they're really callous, they're probably not going to turn around and throw it right in the trash like they might do for a rack card or your business card. So there's some additional gravitas and credibility piece that you get with being a published author. But for my patients, it also gives a more personal way for them to get to know me in depth in a way that they might not otherwise just in our professional interactions, which are focused on them appropriately, but can personalize me to them and show them that, like anybody else, just a human person trying to do my best along the way with struggles and setbacks and triumphs, just like anybody else.
Okay, great. Thank you. What specific treatments or approaches have you found most effective for joint preservation and osteoarthritis management, particularly for active individuals looking to maintain their lifestyle?
Before I answer that, just to piggyback on that last one, you had asked what advice for other people, and
No.
I don't think everyone has to write a book, but I would say, just find some way to express yourself authentically because, there's people can detect lack of authenticity and there's plenty of it around. But on the flip side, people also recognize and validate and appreciate authenticity. So It doesn't have to be writing, doesn't have to be a book, but whatever avenue, if you can express yourself in an authentic way. And to your question about joint preservation strategies, so this was work that I really formed a large part of my practice in sports medicine, where, you know, sports medicine focuses more than perhaps other aspects of orthopedic surgery on joint preservation. And views joint replacement as almost kind of like a failure of the sports medicine joint preservation aspect of it. And so in terms of subspecialists, usually you're trying to preserve the joint, and then when the joint ultimately fails and you have to give up, then you pass the person along to the joint replacement expert, and they replace the joint. So as the sports medicine practitioner, you're trying to have a common goal with the patient of preserving that native joint for as long as possible. So the things that are most commonly talked about are injectables. So that and we use them here: platelet-rich plasma, alpha-2 macroglobulin, hyaluronic acid, probably the three most common injections that we use. But again, I try to take it from a more holistic, whole body approach. And this is where this practice has expanded the way that I've been able to work with patients. And that's because in a traditional setting, you've got set appointments and set treatments and diagnosis and coding, and you come in, get your injection. Well, I want that injection to be successful in the whole system of that organ and that person. And so we talk about, if it's a lower extremity joint, weight. And we've incorporated medical weight loss into the practice because of the difficulties that represents, and the power of the tool of the GLP-1 drugs that have enabled us to give patients an additional tool to deal with the challenge of weight loss. So very important for the long-term preservation of lower extremity joints. Programming patients for strength and stability so that they can protect those joints, working with patients on reducing inflammation, having a healthy diet, all these things that go into enabling them to not only protect the joint, but to be active and to move and to have a continual movement practice that's going to support joint preservation. So look at all those things and what are the areas that they can improve, and then also using interventions that are targeted to enable us to deliver biologic agents directly into the joint to prolong its life and also reduce pain. So some people are having significant pain, and the interventions can help with that as well.
All right. Well, this has been great. I really, really appreciate it. Tell the audience how they can reach you.
So on social media, on all platforms, it's All Day Sports MD. My website is www.alldaysportsmd.com, and my book, The Renaissance Mind, is available on Amazon.
Excellent. All right. Thanks for tuning in to this episode of The Wellness Growth Show. If today's conversation sparked something for you, hit subscribe so you don't miss the stories, strategies, and insights from the front lines of wellness innovation. If you're a founder, operator, or health leader exploring growth into institutional markets and have a story worth telling, I'd love to hear from you. Reach out directly on LinkedIn or YouTube. And if you found this valuable, share it with a peer or post it online. You never know who needs to hear it. Until next time, stay well, keep moving, and keep building what matters.